talk about the latest updates in hypertension. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular diseases, which affects almost 45% of people in age group of 40 to 70. Raised blood pressure is among the most important risk factor for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. So in India, the prevalence has also gone up over 30 years to 38% in male and 32% in women, from 29% and 28% respectively. WHO, despite that nearly half of the people, or 51% of the males and 41% of female with hypertension, were unaware of the condition. Additionally, over 62% of the males and more than 53% of women living with hypertension did not get treatment. Medications was used to control blood pressure in fewer than 1 in 5 males and 1 in 4 females with hypertension worldwide. International Society of Hypertension has raised the ISH 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource-poor settings, optimal care referred to evidence-based standard specification of essential standards of care for low-resource settings. The AHA-ACC has released a scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among patients with low ASCVD risk. Among low risk adults, no atherosclerotic disease or 10-year CVD risk less than 10%, with stage 1 hypertension, blood pressure 130 to 140 by 80 to 90 mmHg. Management starts with non-pharmacological therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacological therapy. Acute respiratory distress syndrome is potentially fatal condition involving lung damage and experts often associated with severe COVID-19. A recent study which appears in Journal of American College of Cardiology reports that metoprolol can reduce lung inflammation and improves respiratory function in people with COVID-19 induced ARDS. Substantially reduce CV adverse events in the STEP randomized trial, affirming the strength finding for an older Chinese population. Among some 8,500 patients aged 60 to 80 in China, trial the intensive target framed 26% of the compromised CV risk. Now, a second major trial supporting a lower target could unite the guidelines, which even among US professional societies range from threshold of 130 to 150 mmHg. 24-hour and nighttime blood pressure measurement were associated with greater risk of mortality and compromise of a composite of CV outcomes. Thus, they may be considered as the most relevant measurement for estimating CV risk. For every 22 by 10 mmHg increment of blood pressure measured at night, the risk of mortality increased by 23% and risk of cardiovascular events by 36%. So I think we are about to say few guidelines regarding the new outcomes or new guidelines for hypertension. Thank you.